Hello, everybody. Thank you for attending this webinar on autism, presented by Brightbod.com. My name is Marcy Starkman. I'm a licensed psychiatric clinical nurse specialist. My talk is going to be based on my clinical knowledge and my experience, but it is in no way intended to substitute or for either medical advice or care or professional opinion. I'm going to present for about 20 minutes. During this time while I'm talking, all your mics will be muted, so to minimize audio interference and so that everyone can hear what I'm saying. But at the end of my talk, I will open up the mics and would welcome your questions and your comments and your responses to the talk. So please don't be shy. We need your input to help get this information out there. And if there's anything that you'd like to say, please at that time feel free to do so. So let's get started. What is autism? Well, autism is considered a pervasive developmental disorder. What I'm going to talk about today are the first two: autism spectrum disorder and Asperger's syndrome. And I know you hear this probably brought up a lot of times. Oh, someone will say, oh, you're autistic, or she's acting autistic. But it is a recognized medical diagnosis. What happens, it's on a spectrum from mild to severe. So Asperger's syndrome, for example, which affects boys with normal intelligence and language development, they are on the higher functioning level, where someone who has an autism spectrum disorder can also be a girl and can be very low functioning without speech, with repetitive movements, which I'll talk some more about as we go on, or very high functioning artists, people who write, people who hold down gainful employment. So it is a spectrum. The symptoms and characteristics of autism, like I said, they're on a spectrum. I picked this picture because the little one, he doesn't exactly seem to be responding to dad hugging him. Now, of course, that could be for a variety of reasons, but we'll assume for this purpose that the child is maybe manifesting an autistic type of behavior by not engaging with the parent. But again, that's just conjecture. I don't know that for sure. It does have to do, autism spectrum disorders have to do with disorders of communication and social skills. What kinds of symptoms does a person with autism display? Well, first of all, I need to tell you that autism is really the fastest growing developmental disability in the United States. About 1.5 million individuals are diagnosed with autism spectrum disorder every year. And this diagnosis tends to be rising from 10 to 17% a year. We don't know whether this is because there are actually more people with it, or that the diagnostic methods are getting better as time goes by. And there's 4 times as many males who are affected with autism than there are females. So what kinds of symptoms do we see? As I said, impaired social interaction. You may have problems with both verbal and nonverbal communication, difficulty making eye contact, very narrow or intense kinds of interests, restricted or negative or stereotypic kind of behavior. Hand flapping is one symptom. I took care of a little girl who was 2 years old who was in love with a vacuum cleaner. And I don't mean actually in love, but somehow she was able to relate to the vacuum cleaner, and it was probably because of the heat that it gave off, but also the humming And anytime the vacuum cleaner would get started, she would come running and try and get on top of it in order to be closer to it, which, you know, is not actually normal behavior that we see in most 2-year-olds. It may also involve physical symptoms like gastrointestinal upsets, feeding problems, and seizures. Again, it's a spectrum. It can be a combination of one of these symptoms or many of them at one time. And the severity depends on the person. It's very individual. So you've seen this in the supermarket. How many of us have seen this? I'm sure many of us have. And our first thought might be, what a spoiled child, or what a misbehaving child, or what terrible parents. Well, I hope after my talk that you look at a situation like this with more compassion and empathy, because it may not be that the child is spoiled or that the parents are bad managers of the kid's behavior, but it may be because the child is actually has some type of autistic spectrum disorder. The way to tell sometimes the difference, autistic people, in my experience, their families, their parents tend to say that their child is having a meltdown. And there's a big difference between an autistic meltdown and a temper tantrum. Usually a temper tantrum has an audience. It has a goal. The kid wants something that it's not being given. Whereas a child who has autism spectrum disorder, sometimes there's no precipitant. It can be that the child is overwhelmed or overstimulating, as a supermarket certainly can be, overstressed, overtired. The child's safety may be at risk, whereas sometimes the kid throwing a temper tantrum is very careful as to where they throw the tantrum so that they don't get hurt. There's no goal involved, like it's not get me that candy, or, you know, I'll scream and hold my breath until I turn blue. The child who is having a meltdown as a result of autism may have to have outside assistance to maintain control. And having attention does not encourage the behavior as it might in a temper tantrum. Why me, people say? Why her? Why my child? Well, there's not one particular cause. In the presence of a genetic predisposition, which is usually always there, it can be also influenced by environmental risk factors, like, for example, a lack of oxygen during the mother's pregnancy and delivery. It could be something that the mother is exposed to, perhaps pollution or some kind of chemical. It may also be an immune response. We're not sure. But it can be a combination, and again, depending on what the stressor, the outside stressor is, plus the genetic predisposition can influence the severity of the disorder on the autistic spectrum. So it's hard to say. We can't point one finger at one factor and say, this is why this particular child is autistic, or maybe why there's even more than one child on the autistic spectrum within the family. What about vaccines? Now, I know that this is a very big talking point in the media and in the scientific community. When I'm trying to interpret research, I look at something called a meta-analysis. And a meta-analysis is a very big study based on many, many, many people, millions of subjects. And all the studies and all the subjects are analyzed before a conclusion, an evidence-based conclusion is drawn. There was a meta-analysis done about vaccinations and also the components of the vaccines that comprise these vaccinations, as well as a child getting, let's say, the MMR, all 3 shots at the same time. All those factors were considered. And this meta-analysis came to the evidence-based conclusion that it wasn't just, that there was no link between the fact that a child either received this vaccine or because of the mercury or the thimerosal in the vaccine, or the fact that it was a combination of several vaccines at one time. And I think we're going to hear more about this. It's a very current kind of conflict in that Mr. Trump seems to have some kind of investment in this particular scientific health-related issue, to which we may find out later, but he is appointing people to look into this. But so far, the scientific research-based evidence says that there is no link between vaccines and the development of autism. So, when can a PWA, or a person with autism, be diagnosed? Usually can be diagnosed between 12 and 18 months is the best time. Parents start to notice that something is amiss with their child. Either they may think that the child's not hearing well, the child's not seeing well, the child's not affectionate, as I showed before. It can be any kind of factors that make the parent think that this child is not meeting their developmental milestones and they need to be evaluated. They're starting to show down here, as you can see, a later study was that they presented the word hug to a control person, which was a person without autism, and an autistic person. And they took what's called a PET scan of their brains. And the control person's brain lit up. In other words, there was more activity related to the word hug than there was in the autistic person's brain. This is kind of at the beginning of development, being able to use brain scans to help determine whether or not a person is autistic or not. And that's going to be, they're going to be used in conjunction with all the standard observations and checklists and things that are currently being used. They don't just decide that they don't diagnose a child with autism based on one meeting, one checklist, one brain scan. It's a combination of a bunch of factors. So there's something to be kept in mind with that if someone is willing, a diagnostician or a healthcare professional automatically says, yeah, your kid's autistic, without having all these other things in mind, then you really do need to get more of an opinion and more of a consensus with people that are specifically trained to diagnose kids. And there are many centers around the country for kids with developmental delays that are able to look at all these different factors. What kinds of treatments, what kinds of services are available? Well, again, they should be highly individualized. Hopefully with the goal of minimizing the impact of these disabilities on the kid and hopefully on the family. It should be a multidisciplinary approach, and by that we mean medical doctor, perhaps a family therapist, occupational therapist, speech therapist, auditory specialist, to evaluate all the different aspects of what's happening with that child in order to make a good diagnosis. They might need speech and language instruction. They might need psychological evaluation. They may need an evaluation for medication. Medication does not on its own help cure autism by any means, but it certainly can help in some situations with some children to reduce the problematic symptomology that the kid is experiencing. It can also help, there are treatments, one is called applied behavior analysis, which is very intensive, 40 hours a week, one-on-one with a particular specialist. There are specialists who do nothing else but help work with children who do have autism, but it depends on what part of the autistic spectrum they're on. Hopefully the kid can be in a regular school. The law says that all of these children, no matter where they are on the autistic spectrum, are entitled to a public education. Granted, some settings are better than others. If they're not integrated into a regular classroom, they still have to receive special treatment for the problems that they are having while they're in school. So that's a whole nother discussion, but it is important to know that children do have a legal right to be to attend public school and receive help for the problems that they do have. Also, help is needed to help the family adapt, the parents, if there are siblings. It's not easy to live with an autistic family member. I always say that a family is like a hand, and if one finger on the hand hurts, then the whole hand hurts. So the whole hand needs to be treated. And new and promising things are coming up with pet therapy, with dogs to assist autistic kids with communication and getting their needs met. Horse therapy, equine therapy is being used, as well as music therapy. So there are more and more treatments that are being developed, and those are coming about as a result of research. And of course, you know, like with any significant problem, more research is needed, and it is taking place all the time. But research takes money. It's also often classified as a mental illness. Mental illnesses are not high up on the list of things that people donate money to. We don't have telethons for autism the same way we do for some physical problems like cancer and muscular dystrophy. It doesn't mean that it's not as important. It's just not as well recognized by the public, and the importance of research is not emphasized enough. Of course, the bottom line is that the person with autism gets the most amount of help that they can get wherever they are in the spectrum. The earlier, the better. That's very important in terms of intervening with a child. So we're back to talking between 12 and 18 months. And ultimately for the person to maybe go to school, to engage in gainful employment, to also live as independently as possible. Those are all very high level goals, but they're certainly reachable. But it does take a lot of people. It's one of those, it takes a village. It requires an awful lot of intervention by an awful lot of people to help a person with autism. Self-care for the autistic person. I like to use something that I call, that's been called the HALT principle. And HALT stands for H is hungry, A is angry, L is lonely, and T is tired. So those four needs need to be met. Is the person hungry? Are they angry? In the case of an autistic person, sometimes they need to be lonely. They need to get out of the crowd. They need to break away from the noise and the overstimulation. And if it's tiredness, they need more rest. And those are skills that can be taught to someone who has autism, and taught to their caregiver as well, to inquire and to say, do you need something to eat? Do you need, maybe you need to take a nap right now, depending on what communication level that person's at. But self-care is important, and that's a goal that we have for someone who is autistic, that they can recognize what their triggers are and remove themselves from it, or meet their needs so that they're not in as much distress. And the same HALT principle applies for the caregiver. Are you hungry? Are you angry? Are you lonely? Maybe you need some support to talk about this. It's not easy to care for a person with these kinds of needs. Are you tired? Do you need a bubble bath? Do you need some Zen? All those things are important. You know the old adage about putting your own mask on first. You hear it on the plane. It says, in the event of an emergency, put your own mask on first before you help others. It's the same thing. If you're a caregiver, you need to put your own mask on first before you can help anyone else, including your autistic child. So another thing are support groups. Very, very important to find out that you are not the first or only person who's been experiencing this. And also that marriage or family counseling may be very important and very necessary to help you cope. None of us are islands, and it's very hard to ask for help sometimes, but we do need to learn how to do that and to find out that that's okay. And finally, this is a list of resources that I just pulled. There are a lot of them out there. These I really, really like. It's a place to start, and they lead you to all kinds of other resources, including online support groups and in-person support groups. And it will take a lot of work to help you cope with this particular set of problems, but with some help, it will become easier. So now I'd like to open up the mics for people who have, and if you have any questions, I'd love to hear what you have to say, any comments, any concerns, any of your own experiences, please feel free. We need to hear all your voices.
Question, isn't 40 hours per week kind of excessive for an autistic child because of their attention span?
I'm sorry, what was, I didn't hear the middle word.
40 hours per week for an autistic.
Well, I think 40 hours a week is probably just a figure pulled because it's a Monday through Friday, 8 hours a day. You know, if you're living with a child with this kind of difficulty, it's going to be a 24/7 job, right? Mm-hmm. But in terms of getting help, lots of time helpers are only available 5 days a week for 40 hours, or that's what's allotted by insurance, and that gets into finances, and that's a whole, I know that's a whole nother talk. So I believe it's a 24/7, that perhaps for the 40 hours you can be taught to help so that you can be as good a helper as the official helper who's there the other, or there for the 40 hours a week. I'm not sure that answered your question. It's not engraved in stone. 40 hours is definitely not engraved in stone. It depends on where the child is and what the child's needs are.
Okay.
Do you know if the other guys are here?
I'm sorry. I couldn't hear that.
I'm not sure it was directed to us.
Okay.
I have a question.
Sure.
Based on what I've heard about Asperger's, I think, I may be mistaken, you'll correct me if I'm wrong, but 9 out of 10 Asperger's, or people with Asperger's are male, and maybe not impossible, but very unlikely that a female will get Asperger's. The question is, if there's so many, there's so many boys who have these disorders, behavioral disorders, I can only imagine that there are at least as many girls who have behavioral disorders also. Maybe not disorders which would qualify them as having Asperger's, but still they might have behavioral disorders. So for that contingent of people, those girls, how are they diagnosed if it's not with Asperger's?
Well, that's a great question. They are considered to have an autism spectrum disorder. Now, there is a specific genetic disorder that does affect only girls called Rett's syndrome, R-E-T-T''S. It again occurs when a little girl is a baby, but with Rett syndrome, the child may have some function to start with, but over time, over about the first 4 years, the child loses all function and eventually passes away. So little girl, not every little girl with autism spectrum disorder has Rett syndrome, but the ones who do have Rett syndrome do decline from having some function to eventually having no function. It's very sad that they're very rare. You don't see that very often. Other than that, again, it requires teasing out. Is this a true autism spectrum disorder? Is this childhood schizophrenia? Because a lot of the behaviors are the same. That's why it does really require an experienced team who's used to evaluating kids with these developmental disabilities to give a proper diagnosis, because the treatments are very different.
Thank you.
You're welcome.
I have a question.
Sure.
We have a very close family friend. She has 3 kids, 2 boys and a girl, and all 3 are autistic. What would cause something like that?
Well, not to minimize it, because that's a very hard situation. I'd say that was a bad swim in the gene pool. I'm not making fun of it by any means, but we do know that the primary predisposition is genetic. So there's something there between the mother and the father that when those kids were conceived, there's something genetically probably going on with all 3 of them. And then whatever is superimposed upon that, either from the environment or the mother's age, could be related to the parent's age. Sometimes older parents are more prone to having kids with developmental difficulties. So again, it's hard to put a finger on exactly what it might be, but I would say that the overlying situation would be probably something in the genetic composition of the parents.
Okay, thank you.
You're welcome.
I'm going to make a comment, because what I have found, I have a nephew. He's going to be 28 this year. His sisters are twins. He has 2 twin sisters. One of the sisters is an RN. The other sister is an accountant. The father, his first degree is in chemistry, and the mother is she's the pharmacist. So they're very highly educated family.
Yes.
You know. So, but the son that was born first, he's autistic. He does operate and stuff like that. He's very functional, but I don't see how generics, would get involved in that, because no one else in the family has come up with as being autistic or show any signs of it.
Yes. Just that one child.
Just that one child.
Right. And are you saying that child is not as intellectually
He is autistic, and I guess last time I did say that, he reads well,
yes.
And he functions. He still has an aide that comes in and gives him certain like a partner, that he partners with. This aide still comes in and partners with him and take him, like, to the movies or the theater, give those social type of skills. But he's very sociable, and speaks very well and everything, but he is autistic. And they had to travel from one state to another to really find out what was wrong with him, because he was not born that way.
Yes. Yes.
Yes.
Well, it doesn't show up sometimes till the child is 12 to 18 months old. But, autism and intelligence aren't necessarily equal to each other. You can have a severely autistic child who is also very intelligent, or you can have a severely autistic child who is not as intellectually gifted. It just, again, it's a whole combination of factors, and they all have to be sorted out. He sounds like he's gotten some really good help, though, which is a good thing. He is social, and that's very important.
Okay.
Well, that's it for this evening. I'd like to thank you all for attending, and it was my pleasure to speak with you tonight about autism, and I look forward to the opportunity to meet with you again. Thank you.